Good morning, ladies. We're so glad that you joined us today. I'm Natasha Brantley. We're here from Good Shepherd, and we have some exciting news to share with you. So today our focus will be on postpartum, what you can expect after the delivery for both mom and baby. And we have some wonderful nurses here to share great info with you. And then after that, we'll go into a little snippet of information about the NICU or neonatal intensive care, in case your baby needs to spend a brief time in there. So today I have with me two nurses from Postpartum. We have Stephanie and Heather, and they have some amazing news to share with you today.
I'm Heather. I've been a postpartum nurse for 24 years now here at CHRISTUS Good Shepherd. And this is my friend Stephanie. You've been here?
I've been here 19 years, almost 20.
So we just want to talk a little bit about what happens when you come over after the baby has been born. Usually you'll stay in labor and delivery for about 2 hours just to kind of recover and make sure the baby's doing well and everything. And then you'll come over to us. When you get to the room, we'll, of course, introduce ourselves, orient you to the room, show you the call light, how to call the nurse, how to work your television, how to work your bed, head and feet up and down, and that kind of thing. We'll go over baby safety. We have a hugs tag system, which is a little alarm that goes on the baby's leg. And it will alarm if anyone tries to mess with it, or if it comes off the baby, or is cut or whatever for any reason, and it locks the doors. And we have a safety word every day also, and pink tags. All the nurses on this unit or caretakers have the kind of pinkish purple tags. The rest of the hospital has black. So we tell you to look for that. Make sure, anybody that's trying to take the baby from the room, especially, make sure they have that tag on, make sure they know that word for the day. And then we do a mother-baby care here, which involves the baby mostly staying in the room with mom. Of course, we'll be coming in and doing vital signs and checking on the baby and you. But for the most part, the baby stays in the room. We do have a nursery available, and a nurse can sit with the baby for a while if you want to take a nap or, something like that, or sleep at night, which is nice. Let's see, what else?
Well, we have some things that we'll let you use for pain. Besides the pain medication that the doctor orders for you, we have these little ice packs here that you can use.
These are great
for your bottom, and we can get you a heating pad for your stomach as well.
And we'll give you this little comfort pack here that has some necessities like toothbrush, toothpaste, lotion, hand sanitizer, that kind of thing. And there's some little books of things you can do while you're kind of stuck here in the hospital for a few days.
Yeah.
And this is the bag that we're giving out now, and it'll have diapers and wipes and pretty much everything you need for the baby, unless you just have something special that you want to bring, like a blanket or a special outfit or that kind of thing. We have all that provided for you. So it's kind of up to you if you want to do that or not.
There's a cute little onesie with a little hoodie and some little mittens in there for the
Which
baby
is new.
as well.
These are new. So
also, there's a little book in here. If you have any questions for the doctor, you can write those down. They're really cute.
Oh, they are cute. Here's the little onesie. Or t-shirt. That's cute, with the mittens and hat. So we'll have everything the baby needs while you're here in the hospital. Usually if you had a vaginal delivery, we pretty much let you get up immediately if you're interested in doing that, if you need to go to the bathroom. Usually the epidural, if you've had one of those in labor and delivery, has worn off by the time you get over here. So you can get up and walk to the bathroom. You can take a shower when you get ready. IVs typically stay in. The anesthesiologists like for them to stay in about 6 hours if you had an epidural, just as a precaution. If you've had a C-section, generally they stay in for about 24 hours. A lot of times if you've had the C-section, they'll put some Durmorph, which is a medication, in through your spinal or epidural, and that lasts for 24 hours for pain control. And it works very well for the patients, but we do like to keep that IV in just, in case we needed to give you something, through that. Sometimes you need Benadryl for itching. That's to be expected if you have the Duramorph. And that's just a side effect, and we can give you medicine for that. Let's see. If you had a catheter from after a C-section, that usually comes out the following morning. Occasionally, some of the doctors like for them to come out the same evening, so it just kind of depends on your physician. But for the most part, they come out early the next morning, and then you'll start getting up more. We get C-sections up to the bathroom and do some pericare, usually between 8 and 12 hours post-delivery, and then they'll get you up again in the morning, usually around 5 o'clock, to take your catheter out and let you start voiding on your own. If you have, they'll have you come back to the office in about a week to have those removed. A lot of times they're using Dermabond now, which is just kind of like a super glue. And that just kind of wears off on its own, so you don't have to go back and have anything removed.
About a week.
Right. And normally they'll see you back in 1 to 2 weeks after a C-section. If you had a vaginal delivery, they'll like for you to come back at usually 2 to 3 weeks, and then they'll see you again at 6 weeks, just to kind of make sure everything looks okay. Let's see. We have OB hospitalists available 24/7. They'll work with your doctor. If your doctor happens to not be here and there's an emergency, we have those available all the time. We have an OB emergency department also that sometimes takes care of people that might come in with like a blood pressure or just need to be monitored for a little while. So that is available to everyone. Bathing of the newborn, we usually do about 6 hours after delivery, unless for some reason if they have like a blood sugar issue or not eating well or something, we might wait longer. But for the most part, we bathe them after about 6 hours. They maintain their temperatures better, studies have shown, if we wait, at least 6 hours to do that.
And we also promote skin to skin for the mom and baby
Right.
after the delivery and during her stay.
Right.
And at home as well, but it also helps with the baby's temperature stabilization and blood sugar and the baby's vital signs.
And the respiratory and heart rate also, that's very good for the baby. Just to put the baby with the diaper on, just right up next to you. And if you're breastfeeding, that kind of helps encourage the baby to kind of get a feel for what's going on. And they'll start kind of rooting around to find that. We have lactation consultants available also here if you're having trouble with breastfeeding, or if you just need some tips or maybe some help with that. And they can also see you follow up after you go home. If you're still needing help, sometimes they will see you after a couple of days. Let's see, we talked about the HUGS tag. Visitors right now, due to the COVID, of course, they're only allowed one visitor at a time. The waiting areas are all closed, so nobody is allowed to sit in there. One visitor may stay overnight. No one under the age of 16 is allowed, of course.
And they can switch out.
Right. We're letting, they can switch out with one other person, but they have to do that downstairs, not here on the unit, of course. Let's see, typical length of stay for a vaginal delivery is 24 to 48 hours. For a C-section, they usually stay 48 to 72 hours. If for some reason your baby has to go to the NICU, however, vaginal deliveries, of course, can stay 48 hours. And then C-sections can stay 4 days. Let's see, typically, we talked about the follow-up. We have a celebration meal that is provided for you and one other support person. That's really good, although everyone has said it's wonderful. But otherwise, meals are not provided for visitors. There's a cafeteria, however, on our same floor, so it's conveniently located. And it's open till like 1 or 2 o'clock in the morning. So if you have food delivered, you just have to have someone that can go down and pick it up. at one of the entrances, of course, due to the COVID. Let's see. The babies usually follow up with the pediatricians, usually around 3 to 5 days. Sometimes they'll follow up with the lactation nurse, like I talked about. Usually that happens in 1 to 2 days, and then they'll have you see the pediatrician in 3 to 5 days.
And if you don't have a pediatrician, we can always provide you with a list.
Right.
So you can
We have a list
decide.
available that can help you figure out who you want to follow up with. And we always have, of course, pediatricians on call that will take care of your baby while you're here if you've undecided about what pediatrician you want to follow up with. And again, the OB emergency department is available also for postpartum complications. If you were to have a blood pressure problem or heavy bleeding, headache, blurry vision, anything that just needs to be kind of monitored, they will take you to the OB emergency department, and the hospitals will take good care of you. I can't think of anything.
What about if they have a little boy and needs circumcision? When does that happen?
Circumcision. Okay. Yeah, usually that happens the morning that they're going to be discharged. What we usually do is ask you, of course, when you first come to the unit, if you plan to have your baby circumcised. If so, we'll get a consent sign, and usually the mom's doctor will be the one actually doing the procedure. Sometimes the doctors use a cream that kind of helps numb up the area. Sometimes they use like an injection of lidocaine that numbs up the area again. But we have several different comfort measures that help them get through that without any trouble.
We give the baby a little sugar water. It's a little
we call it toot sweet.
But that helps to calm them down, and then we, soothe them while the baby is having the procedure.
Yeah, we found that if we swaddle the baby's arms instead of what we used to do is kind of strap them down, but the swaddling is real comforting to them, and they've done a lot better with that. Usually we just recheck that in about 30 minutes, and of course we like to make sure the baby can urinate after the procedure. But the care for it is very simple. Generally, it's just some gauze and Vaseline that we will provide for you, and we will show you how to take care of that when we do usually the 30-minute check. We'll show you how to change the diaper and how to clean what needs cleaning and how to put a new Vaseline gauze on. Usually the circumcision is completely healed in 4 or 5 days. It heals very quickly. The first day, it's really rough. I like to warn my moms that it's going to look bad, especially first-time mom. It looks pretty red and angry and sometimes a little puffy. That's normal. The second day usually looks like 75% better. And again, it's usually completely healed in 4 or 5 days. So that's not usually a big issue. And it's easy care. So you shouldn't, I don't know. What else? Anything else we need to talk about?
So there's a couple of other things that you need to know that are available to you. First of all, there's translation services. If you are with someone or you yourself need help with a different language, we do have translation services. Some of our nurses actually speak Spanish as well. Stephanie is one of those nurses. She's fluent, and you can really count on her for that. The other thing is that we have chaplain services available in the hospital as well. And especially if you have had complications or if you've had an outcome that really is causing you to be sad, depressed, grieving, or if your baby is just in NICU and you're worried and anxious, you can always ask nurses to call in chaplains for you, because they are more than happy to come and pray with you, help you. That's part of the mission of this hospital, and extending the healing hand of Jesus Christ. And so our to make sure that that's very easily available to you. The circumcisions, I want to tell you that nobody's pressured to do any procedures that they don't want to do. You're not going to have any grief if you choose not to do it, but it is available to you. It's really important that there's open communication between you and your team of nurses and your providers so that we can take care of you and meet your needs the way that your expectations are. Again, like I said last week, we're not mind readers. We do our best, but there may be little things that are important to you, but we don't know that if you don't share that with us. But once you share that with us, we'll go out of our way to make sure that we can accommodate you. So the pediatricians actually come to the bedside and talk with you when they assess the baby. If there's a reason why the baby needs to be assessed in the baby lounge, they'll talk to you about that so that you understand why your baby needs to leave for a few minutes. But typically, the pediatricians come to the bedside, so you're the first one to know what's going on with your baby. If your baby's in NICU, we have a wonderful lady named Bonnie, and she's going to talk to you about everything that happens there and show you some things that you might see there. And again, the staff there and the pediatricians will definitely keep you up to date with what's going on with your baby. We're glad you came. We're going to switch you over to Bonnie at this time. And we also will take questions, but we really like to do that at the end.
Good morning. We are so excited to be with you on this journey. As they mentioned, my name is Bonnie. I am the clinical director for the NICU as well as the Women's Care Center here at CHRISTUS Good Shepherd. I have been at CHRISTUS for 14 years now, 13 years in the NICU, and recently took on the role of the clinical director. So I kind of wanted to talk to you a little about what you can expect if your baby has to come to the NICU. So typically the things that'll bring a baby to the NICU are if your baby's born too early, which is not something most moms typically expect. Any baby that is born before 35 weeks gestational age will automatically be admitted to the NICU. And then sometimes our term babies have some complications that will bring them here as well, such as low blood sugars, or they may have some problems with their breathing when they're first born. Or a couple of days after delivery, their bilirubin level may get too high, which is a breakdown of red blood cells in the bloodstream. And the baby just can't process it as fast as they normally should. And so sometimes those levels will increase and they'll require some therapy called phototherapy, which is a blue light that shines over the baby. We protect their little eyes, and it just usually takes a couple of days and then we're able to take that off. So what can you expect when you come to the NICU? So the first thing we're going to do is, if you're not able to come to the NICU immediately, one of our nurses or one of our providers will come out to the room and give you an update on your baby. The first time that you visit, we'll have you come in and we'll bring you to a parent scrub sink where you'll wash your hands for at least 20 to 30 seconds. Usually singing happy birthday to yourself a couple of times is a good way to keep track of how long you've washed your hands for. After that, we'll bring you over to the bedside and we'll introduce you to some of the equipment. You can see some of it behind me. So most of our bigger babies are admitted to what we call a radiant warmer. This provides heat to your baby while they're here in the unit. Typically, if our babies come over, they're just with a diaper on, so we can check their breathing and we can assess them very easily. And so they need a heat source, and so that radiant warmer can provide heat to them. If your baby's a little bit smaller, they may be in a special type of bed called an isolette. Maybe you've heard it called an incubator before. This is a type of bed that is kind of encased. It has like a plexiglass all around the baby with little armholes where you can reach in and touch your baby. But it just keeps that airflow from coming across the baby. Your baby may have to be hooked, or all of your babies will be hooked to a monitor that monitors their heart rate, their breathing, as well as their oxygen levels. Those sometimes will go off for no reason, so don't necessarily be alarmed if your baby's alarm does go off, but it helps us to monitor how fast they're breathing and if their heart rate's a good rate, or if their oxygen levels are good. Speaking of oxygen, if your baby comes over because they're having some breathing difficulties, they may be on various types of oxygen equipment. We have ventilators. We have something that's just, it looks like a cannula in their nose, but it provides a little bit higher pressure called CPAP. We have another one that is called high flow, which is again a type of nasal cannula, the little oxygen tubing in the nose, and it provides a higher pressure than what would come out of the wall, say something you may be on while you're in labor or in your C-section, but it's lower than the CPAP. Your baby may have to have an IV. If they're having breathing difficulties, a lot of times it's not safe to feed them immediately. So we'll have to start an IV to give them some nutrition and keep their blood sugars up. If your baby is having issues with blood sugar and the feedings are not keeping those levels elevated, then your baby may have an IV that we start in order to elevate those blood sugars. If your baby's having breathing difficulties or they're too little to eat from a bottle or from the breast, then they may have a tube in their nose or their mouth where we can feed them. Our babies that are having respiratory issues that are requiring oxygen, we will put one of those tubes in either their nose or their mouth in order to help keep the extra air from going in their bellies. So unless they're intubated, we have no way to control if the air goes into their lungs versus their tummies. So we want to make sure we get all that extra air out of their tummy. So when we talk about IVs, I do want to go ahead and let you know that our IVs can go in several different locations. The most common are the hand or the feet. Sometimes they'll go on the upper arm, and sometimes, and even as scary as it sounds, we have to put IVs in their little scalps. I know that sounds scary, but in case your baby does come here and you see that, I want you to be aware. Let's see. Your baby may have to have some lab work done. Typically when babies are admitted to the NICU, we do blood sugars, and that's usually through a little poke on their foot. As well as other labs, we may check labs to make sure their white blood cell count's okay, their red blood cell count's okay. We may do other labs to see if they have an infection, which is called a blood culture, and those usually take 48 hours to get final results back. And then we will also still do your baby's newborn screen. In addition to that, your baby may have some medications that we do. Sometimes we'll start antibiotic therapy if we suspect that there may be a reason for an infection for your baby. So the antibiotic therapy usually consists of 2 medicines to begin with. That's ampicillin and gentamicin. Those are usually for just a couple of days till your blood cultures come back. If your baby does have sign of infection or shows infection, then your providers will be able to talk to you about the appropriate course of antibiotics for the baby. We talked a little bit about if your baby's blood sugar is low, then they may need some IV fluids to help get that blood sugar back up. Usually we give something called D10, which is just a little bit of sugar water for the baby. And then the other option that we have is you may have TPN, especially for our smaller babies or our babies that are unable to eat for several days. We want to make sure they're getting good nutrition, so we may provide them an IV fluid called TPN that has sugar in it, it has vitamins in it, it has different proteins and nutrients in it, so your baby can get all the nutrition that they need. Sometimes we are not able to get babies IVs in their hands or their feet, or they need a sugar concentration higher than it's safe to give in an IV in the hand. So sometimes we put IVs in their belly buttons. There's a vein and an artery that are in that umbilical stump, so it allows us to put a catheter in there and give the proper nutrition to your baby. If for some reason we do have to place that special IV in their belly button, we will definitely let you know and get a consent sign. Sometimes if it's emergent, we will place that and then let you know afterwards, because we want to make sure we're providing good care to your baby. So those are the most common reasons our babies come to the NICU. While they're here in the NICU, they're going to be cared for by our 2 neonatologists, Dr. Chris and Dr. Chen, as well as our nurse practitioners. So these are specialized nurses that have gone to extended training, and they work along the side of the provider to provide care to your baby. So they help the doctors write orders, they help the doctors do assessments, they are here 24 hours a day, 7 days a week, they're always in-house. And so we are able to make sure that someone is always here in case there is an emergency for your baby. Sorry about that. Some other people that may be caring for your baby include the nurses. The nurses are usually staffed with anywhere from 1 to 3 babies, depending on how sick our babies are. They are here to help support you in providing care, as much care for your baby as possible while your baby's here in the NICU. We encourage you to be very active. If your baby has to come to the NICU in their care, ask as many questions as you would like, and visit as often as you like. And we'll talk about visitation here in just a little bit, and participate in as much care as possible. Now, sometimes the babies are very, very sick, and so there's a limited amount of things that we can involve you with in the first few days. But as soon as things kind of turn around or you can become more active in the care, we will definitely help you to do that and participate with your baby. A couple of other people you may see in the unit are our respiratory therapists. They help manage all of the different types of respiratory equipment that we have for our babies. We have a speech therapist here in the unit. We'll work with you if your baby is needing to bottle feed. Sometimes babies can't immediately go to breast, and we sometimes have to give them a bottle before we can offer the breast. Usually that's because babies were born too early and they just don't have the stamina to nurse at the breast, or enough stamina to express the milk from the breast as much as possible. So I have someone joining me. She is one of our nurse practitioners. Her name is Dawn. So we want to welcome her.
Hello.
So we also have an occupational therapist here in our NICU, and her role is to help your baby with different positioning to make sure that part of their care is called developmental positioning. So they assist us with that. They help do some range of motion exercises with your baby, or help make little splints if your baby needs a splint. And they will actually help you, teach you how to do massage therapy with your baby, the different areas that you can massage your baby for comfort, and also how to swaddle bathe your baby, which is a technique where you actually keep your baby swaddled up while you bathe them and just expose one extremity at a time to help provide comfort. So one thing we do offer here is if your baby does have to come to the NICU, but we realize that your baby may need specialized care, we offer a service called Tele-NICU. It's through Children's Medical Center in Dallas, where we can actually connect with one of their neonatologists and provide a consultation via our Tele-NICU cart. And I have it here behind me. Maybe we can see it. So it's that one way back there. Dawn's going to point it out for you. So it's actually a video. We invite you and the provider and the nurse at the bedside to participate in the conversation. They can actually see you on the screen. They can see the baby on the screen. They can actually listen to the baby with a stethoscope. They can look in the baby's mouth. They can look in the baby's ears, all via that special cart. So that's something that we are happy to be able to offer, so your baby doesn't have to necessarily transfer out of our facility, and they can stay close to you here at home. We do encourage our moms that if they are unable to put baby to breast immediately after they come to the NICU, that you start pumping. If you are able to put baby to breast, we encourage you to come here as often as possible in order to nurse your baby. We do have pumps available while you're here in the hospital. You can actually have one out in your room and you can pump out there. We have one in a pump room here in the unit if you have gone home and you're coming to visit baby and you're going to be here for several hours that day. You just take all those little pieces of equipment that you had in your room home with you, and you can bring those up here instead of having to bring a big pump with you every time. As a reminder, some of you may not be aware that your insurance company can provide a breast pump to you. So if you are discharging and you know your baby's going to be in the NICU for a little while and you're going to have to pump milk, and we encourage you to go ahead and contact your insurance company in order to get that pump. Our lactation consultants are available to come assist you with setting up your pump in your room, or if you're nursing your baby here in the unit and it's either immediately after delivery or it's been a while since you've delivered, but it's the first time your baby's going to breast, we can arrange for them to be here during those feedings in order to assist you. And we do have some big freezers here in our unit, so you don't have to keep all your milk at home. Some of you may be super milk producers and just have a ton of it. And we do have a space where we can put some of that milk. We may have to still have you leave some of it at home because we are limited in space depending on how many babies we have. Talking about beds for our NICU, we are a 31-bed unit, and we have been open since 2004. We're the oldest level 3 NICU in the East Texas area. So a lot of our nurses have been here for many, many years. They're very, very experienced and are excited to provide care to you and your baby. Another thing that we are also very excited to be able to do for our moms is we have something called the NICU camera. So if your baby's born and it's here in the NICU and you're not able to stay in the hospital anymore, it's past the time that you're able to stay, we are able to set up a camera at the bedside where you can see your baby via your computer, your iPhone, over a secure network. And you log in and you're given a password, and only you have access to that password unless you choose to give it to someone else. And you can see what's going on with your baby. You won't be able to hear sound and things like that, but it is lifetime video of your baby. So we're very excited to be able to offer that to our moms. It is on a first come, first served basis. Unfortunately, we don't have enough cameras for every baby we have in the unit, but if that is something you could be interested in, let your nurse know, and we'll be happy to work with you to try to set that up. So your baby's been here in the unit and you are getting ready to go home. Now, some of you, especially if your baby's been here for a really long time, may be a little nervous as well as excited about that, maybe have a little anxiety, or if you're a first-time mom, you haven't really had a chance to spend a lot of time with baby one-on-one, so you may be a little apprehensive about what's going to happen. So we encourage our moms to room in with the baby before going home. That's you going out to a room on the postpartum unit with your baby and you providing total care with support from the nurse. So the nurse will still come and check on you, round on you, answer any questions you may have, but you will be the one providing most of the care to the infant at that time. There'll still be some opportunities for education from the nursing staff if you have any questions or concerns during that time. We typically encourage our moms to room in 1 to 2 days, kind of depending on how long your baby's been in the unit and how much time you've been able to come and visit with your baby. But that is something that we encourage our moms to do prior to discharge. So that may be another question you're going, well, how long is my baby going to stay in the NICU? Unfortunately, there is no steadfast rule of how long your baby's going to be in the NICU. Typically, we tell our moms if your baby's born early, you can anticipate your baby going home about 2 weeks before your due date to 2 weeks after your due date. Every baby's different, so every baby's going to progress a little bit differently. God made us all unique, and so every baby's situation is unique, so we don't have a set date that your baby's going to go home. What we do have are some general guidelines that help us know that your baby's getting ready to discharge. So we know that your baby's ready to discharge when he or she can eat all of their feeds from bottle or breast, when they can hold their body temperature outside any type of warming device, so outside of the isolette that we talked about or outside of the radiant warmer, and eating and holding their body temperature burn a lot of calories. So your baby still has to show that he or she is gaining weight at an appropriate rate coming out of the isolette and eating all their feeds. We also have to have, just because your baby can eat for the nurse doesn't mean they can always eat as well for the parent. So we need to make sure you're here feeding the baby as much as possible and comfortable doing so, and baby's eating well for you as well. There's also a couple of things that your baby will have to do. So one is a car seat test. If your baby was born less than 37 weeks gestation or less than 2,500 grams, your baby will need a car seat test before they discharge. This is a test that we put your baby in the car seat. We can put a blanket roll kind of on the side of them or around their head in order to make sure they have the proper alignment in the car seat. And then they just sit in the car seat for 90 minutes or whatever the duration of your first ride home is. We have some people that may live a little farther than 90 minutes away, so we want to make sure your baby can tolerate the entire time that it would take to get home for the first time. And during that 90 minutes, we watch to make sure that your baby's heart rate stays at a good level, that their oxygen level stays at a good level, and that they don't have any periods of slow breathing or periods where they forget to breathe, which is called apnea. So after that 90 minutes is over, if baby does well, then baby's cleared from the car seat test. We also encourage our parents to take, especially if our babies had any type of respiratory distress or were born early, to do a parent CPR instruction video. This does not certify you in CPR, but it does give you an idea of what to do in case there is an emergency at home. The video takes about 20 to 30 minutes, and then the nurse just kind of goes over some of the steps with you to do if your baby's choking or how to initiate CPR. So we highly encourage you, if your baby spends any time in the NICU, even if you don't meet the qualifications of having to have CPR, asking them about it, because it's always safe to have. Do we have any questions on our end? Or Dawn, is there anything you'd like to include?
I think Bonnie was extremely thorough and just definitely open for any questions y'all might have at this time.
All right. Well, if there's not anything else or any questions that our group has, please stay tuned for future broadcasts. If you would check out our CHRISTUS Health website for Good Shepherd, you'll be able to see the links for our previous broadcasts and be able to get information about future broadcasts. So if there's no further questions or concerns, again, we thank you so much for joining us and look forward to joining you again. Thank you.
Bye.
Bye.
Bye.